There's tremendous research now going on in universities regarding the germs in our mouth, the bacteria in our mouth, and how that affects our immune system and how that affects our bodies systemically. And what they're finding is pretty incredible stuff. Many of the germs in our mouths that cause disease, especially gum disease, all right? Number one, they don't live by themselves. They live in groups, and they're called biofilms. And these biofilms are almost like a primitive little organism, and they're very difficult to kill, okay? Really, the only way you can kill them is if you disrupt them mechanically, okay? Things like mouthwashes aren't gonna do a darn thing to them. And what they do is they can cause and will cause inflammation in our mouths and our gums get swollen and red and bleedy. When our gums are swollen, red, and bleedy, they become porous. And these bacteria can go right through your gums and they enter your bloodstream. And they do this thousands of times a day. We have this stuff circulating. And yeah, your immune system's gonna go in and attack them. But what they do in the mouth is they cause inflammation. And that's bad. What can that lead to? Well, it can lead to gum disease, and it could possibly lead to tooth loss, and that's not a good thing. But what we're learning is when they get through and enter your body, they cause inflammation downstream. And that's where they're really starting to cause havoc, and they're really being linked to the formation of plaques in our blood vessels, which can lead to heart disease. There's a whole mechanism that is really that really involves these germs and how they can set off an inflammatory event. I'm not going to get into the whole science of this, but by and large, there's definitely a linkage, okay, between the oral bacteria and what's going on downstream and our immune system, definitely. And it's affecting our immune system. It is causing inflammation in our bodies, and it could possibly be leading to heart disease and being linked to maybe possibly some kind of cancers, low birth weight babies and pregnant women, affect people suffering from diabetes. The list is getting longer and longer and longer. And I've had some empirical evidence. I can think of one patient who came in really bad heart issues and had very bad periodontal disease. And we worked with our lasers and so forth, got him cleared up very, very well. And lo and behold, his cardiologist has told him his heart indices are all very, very good right now. So that's empirical. That's not a scientific example, but it's good enough for me at least to know that I think I'm certainly not hurting these people getting their mouths healthy. And I think just based on the research, if we can keep these germs under control in the mouth, get the gums healthy so they're not inflamed, decrease the inflammation in the mouth, decrease the transfer of these biofilms into the body, and decrease that inflammation in the body, it can only better the patient and improve the patient's health. And there's a whole organization, I'm a charter member of it, called the American Academy of Oral Systemic Health. And we believe firmly in this, and we think ultimately it's gonna change the way certain diseases are treated in the future. Many cardiologists are turned on to this. We personally feel that dentists and cardiologists, physicians should be speaking and working as a team to treat these patients. I think if a patient is seeing a cardiologist and has rampant periodontal disease, probably best to clear that up, and I think a lot of cardiologists agree. I think it's a tremendous service to the patient to take this approach and to educate them about this. You're giving them a reason to floss. You're giving them a reason to take care of their oral health.